Dear all, good afternoon and greetings. It's my pleasure and privilege to be a part of 4th International Scientific E-Conference organized by Texila American University. Myself, Savita Nepali, currently working in Abu Dhabi, United Arab Emirates, would like to share my views on the topic knowledge and attitude regarding electronic medical record uses and implementation among healthcare personnel in Capital Health Screening Center, Abu Dhabi. This is submitted by myself, Suni Nair, and Bindu Samuel from Texila American University in Fujairah in United Arab Emirates. As we know that information technology has emerged in the world, affecting our personal, social and public life, and has made a significant impact on quality life. Today, revelation in the medicine caused by the internet and its related technologies shows that EMR is vital for the success of decision making, ease of operations, communications and record keeping, and as well as for obtaining higher productivity from the system. Our primary institutional goal would be to have a system that streamlines patient information. We know that an electronic medical record is the legal and longitudinal record for patient health information that is created in digital format in hospitals. An electronic medical record system with automated clinical decision support moves paper-based processes online, which delivers a comprehensive view of a patient's details from a single source. It automates and rearranges patient medical records to improve their utilization and thereby lead to improved patient care. The quality of healthcare will improve not only because of computer-aided diagnosis and management, but because of an overall improvement of efficiency. The EMR system may include computerized demographics, medical history, allergies, lab tests, radiology images, billing system, inventory, financial accounting, and several other fields of medicine. Computerization of any medical establishment is an ongoing measure and can be divided into two broad categories, that is administrative and clinical. As administrative includes billing, inventory control, financial accounting, and correspondence, while in clinical, the patient case sheet, generation of prescriptions, immunization schedules, dosage calculations, antenatal follow-ups, ECGs, the others are evaluations are included. As we know, when we see about the background of the electronic medical records, the concept of computerized or EMR, which was first described in the 1960s by a physician named Lawrence Alveed. His work was collaborative effort between physicians and information technology experts started in 1967 to develop an automated EMR system with the aim of developing a system that would deliver timely and successful patient data to the physicians and enable the quick collection of data for epidemiological studies, medical audits, and business audits. The EMR systems evolved from just a simple tool to digitalize the hard copy of medical records to be nowadays fully integrated systems with feature-rich platforms. Increasing medical urgency, new health insurance policies, complex healthcare systems, installments on long-term medical procedures, and daily medical records are part of every healthcare organization now becomes vital for every healthcare industry to obtain EMR systems to make their working efficient at low operating cost. Here we can see some of the pictures from the newspaper in UAE regarding EMR. The integrated health record system launched and now is live in UAE. There is Salama medical records. The United Arab Emirates is actively expanding its national healthcare system to meet the growing needs of its people and support economic diversification. All 7 emirates provide healthcare services to their citizenship and are rapidly building their healthcare infrastructure inclusive of hospitals and clinics, while simultaneously developing their local workforce also. In the UAE, there are 5 government healthcare regulators: the Ministry of Health, Ministry of Finance, Federal Health Insurance Authority, Dubai Health Authority and the Health Authority Abu Dhabi. The significance of my study. The use of electronic medical records in healthcare settings can improve the healthcare delivery. It helps in systemic, clear, and well-arranged medical information of a patient will put together for easy and quick access. In order to have a better understanding of the magnitude of the documentation problems in the current EMR, a needs assessment was recommended. Understanding the positive and negative aspects of a system through the solicitation of information from current system users can aid in the selection of a new system or guide revisions to the current system. Another important point is the necessity of frequent involvement of different members of the healthcare team in the development of a meaningful use of EMR. With the widespread implementation of EMR systems nowadays, healthcare personnel encounter numerous challenges when dealing with EMRs. One of these issues is the reading of a voluminous EMR. The problem intensifies with the limited permitted time to be spent per person and the existing capability limitation of the available EMR systems. In the UAE, the same issue has arisen among healthcare personnel working for local healthcare providers too. A lack of integration within an EMR leads to numerous problems, may lead to omitted and duplicated entries. Barcode scanning is another essential piece of a meaningful use of EMR. An integrated EMR would allow the nurse to document the procedure one time, and the information would populate in additional needed areas. The challenges of voluminous medical record. EMR content is not limited to a patient's basic demographic information and recent medical procedures. It contains all medical information about the health regulator's action for any abnormal medical conditions. I would like to talk about the nurse's perception toward electronic medical. This is the workplace where I work. It's Capital Health Screening Center. It's located in Abu Dhabi. And I would like to talk about nurses' perception toward electronic medical record. Medical record, it is found that some nurses reported spending up to 60% of their time doing computer documentation, but these claims were not confirmed by observation. Results of other studies that evaluated whether electronic documentation is more time consuming are conflicting. In one of the few recent studies to examine this question objectively, time spent by nurses documenting or EMRs compared with paper charting, there is little difference between time spent documenting with EMRs or with paper-based charts. Nurses spend 19% of their time completing documentation regardless of method. This finding suggests that integrated electronic medical records and computerized nursing notes do not increase the time nurses spend charting. Whether such findings are generalizable to other nurses in other settings is unknown. In short, I would like to tell about the pros and cons of electronic medical record. We can see that electronic medical record, there are several secondary uses of data from EMR that can improve healthcare services, which include population and disease research, detection of adverse drug reaction, assessment of outcomes of interventions, shaping health policies, and guidance on effective use of resources. EMR data can be an indispensable source for population and disease research, especially when it can be linked with mortality records and genetic data. Electronic health records have distinct advantages over paper. So we can see that, in short, excellent electronic storage mechanisms for the massive amount of medical records. It helps in effective communication between health service groups, easy access anywhere, anytime, user-friendly, interactive interface, quickly finding key data, reduction of medical errors, improvement to patient safety, facilitation of cooperation with other service providers, better management for business workflow, integration of different health services, better financial management, support to clinical and business decision making. We have many advantages, as well as we can see there are many cons side of the EMR also. Some of the disadvantages of electronic medical records, we can say that much skill required. The main issue when it comes to EMR is the simple fact that maintenance is needed and problems can occur. Because of this, skilled technicians need to be available at all times. If one small thing happens, the entire office could be shut down. This also means that the current employees must receive additional training to use the technology. Minimal error could mean big loss. If one small thing is done incorrectly, large amounts of data can be lost. This is a big problem, especially in the medical world. Patient information is sensitive and may be hard to retrieve if it's lost for any reason. IT infrastructure in the UAE currently consists of independent healthcare systems, and integration toward a comprehensive nationwide information technology healthcare system is a priority. So health efficiency and quality of health services and user satisfaction has been increased with implementation of EMR. The methods of study is this was a cross-sectional study covering 27 respondents aged 18 to 45 and above years who are well educated working in healthcare sector in order to identify the knowledge and attitude regarding use of EMR. Data was collected using interviewer-administered questionnaires, key informant interviews, focus group discussions, and record review. The results of study, as we can see in this graph, a total of 27 completed surveys were written out of 210 for a response rate of 12.25%. The majority of the participants were female. It was 81.5%, and above 30 years of age it was 33.3%, and most of them are registered nurses. Findings is in conclusion, I would like to say that overall effectiveness of EMR implementation was good. I would like to suggest about the recommendations. Prevention of medical error is a very important part of healthcare. Improvements in EMR can have a positive impact on the prevention of medical errors. If an improved EMR can be found to prevent documenting the same skill in more than one area, there is a less chance of making a documentation area. The lack of integration in a hospital EMR can have a negative impact on nursing and organization. To ensure a positive practice change at the hospital, the committee selecting the new EMR or revised EMR should include current users, as well as any changes which are incorporated into the current EMR needs to be clearly communicated to users of the system. So in conclusion, the overall effectiveness of EMR implementation was good. Clinical teams using EMR systems in their practice are likely to face many challenges. However, user support and arrangement of replacement training may improve the efficacy in usage and implementation of EMR. Thank you so much.